Hi, active Austinites. This is Dr. Mary Arnold over at Natural Fit Therapy, and I wanted to come on and discuss today a little bit about some of the myths associated with sciatica. It's a very common diagnosis and issue that people deal with, and with that comes a lot of hoopla about it, and we almost don't know what to believe, what's true and what's not. So I wanted to go over 6 kind of big myths associated with sciatica and kind of debunk those for the world, right? So we talked a little bit in another video about one of the biggest myths that I hear is that people come in and they've been diagnosed with sciatica and they think that that they have a disease and that something is internally wrong with their sciatic nerve. And that is just not true. Sciatica is not a disease. Sciatica is a term used to describe symptoms that come down the back of the leg and that usually have some type of origin from our spine. So sciatica, not a disease, a term used to describe these symptoms. And like we talked about before, those symptoms can be pain, numbness, tingling, and sometimes even, weakness in more severe cases. The next myth is that if whoever has been diagnosed with sciatica is that everybody's symptoms are the same. And that is just not true. And that's not true with almost any diagnosis that I see here in clinic. I could have a prescription that says shoulder pain. I could have a prescription that says sciatica. I could have a prescription that says back pain. And each of those people who come in to see me are going to have a different medical history. They're going to have a different cultural history. They're going to have, most of the time, different symptoms in terms of where they're located, the intensity, what types of activities aggravate or make their symptoms feel better. So just because you have been diagnosed with sciatica and your friend down the street has also been diagnosed with sciatica, it is very common that both of those people who have been diagnosed have very different symptom presentations, as well as different causers of their pain, as well as they might even be treated differently and have different exercises that they're performing, as well as different physical therapy techniques that are going on because maybe their sciatica is coming from different areas. The next myth that I want to go over is that sciatica never goes away. It's just something that's always going to be there. And that's simply not the case. Again, I don't have a magic ball and I can't tell people when their symptoms are going to go away or what's going to be the most effective treatment. But usually, and in most cases, we can get sciatica better and we can treat it very effectively, conservatively, as well as kind of to go over the next little myth that I'm going to debunk is that sometimes surgery is warranted and can be very effective form of treatment depending on exactly what's causing that sciatica symptom. So next case is nobody needs surgery. Everybody just needs to do exercises and they're going to get better. And that's true for the majority of people, right? Majority of people just need conservative management to help get to the root cause of their problem and manage their sciatica. But there is a small percentage of people who do need and who really benefit from surgical intervention and having a good look over by your medical doctor, as well as having a thorough assessment and treatment plan provided by a physical therapist will be a good way to determine if you are going to be one that responds well to conservative management, or if we do need to go a little bit more in depth and if the medical team needs to move forward into some of those surgical discussions. But even if you have to have surgery, outcomes are very well. And having physical therapy before and after just improves those outcomes. We've got one last myth, and that the last one is that sciatica can cause permanent nerve damage, right? And is it true that irritation, or in some people's cases, damage of the sciatic nerve, it might be high enough, and it might be there might be something going on that's a little bit more sinister in pathology, that sometimes there are some permanent changes. But most cases, sciatica does not cause permanent nerve damage. It is very rare and in very few cases. And usually the cause of their sciatica is something a little bit, more sinister or higher level, to where that nerve is not just irritated, it is being compressed, as well as the blood supply has been affected. And again, that is very rare. So most people who come in and have sciatic nerve problems can be rest assured that unless they're having more sinister signs and symptoms, which I would expect a lot of motor loss in the leg, as well as different changes in bowel and bladder, but people who are not really having those symptoms can be rest assured that they're probably not going to have permanent nerve damage to their sciatic nerve. So please post any questions down below about any of those myths that we just talked about. And again, if this is something that is a part of your pain problem, please feel free to visit our website and sign up for a discovery visit so that we can discuss some of this stuff together and in person, and hopefully come up with a treatment plan and way of attacking this so that we can get you back to doing the things that you like to do. Stay active, Austin, and keep moving. I'll see you next time. Bye.